Good morning. Welcome to the lecture on synovial joints. In this lecture, we will be discussing about the major synovial joints, which are hip, knee, shoulder and elbow, from the point of view of structure and function. Now, let us consider the general structure of a synovial joint. The synovial joint actually allow free movement of articulating bones within a fluid-filled cavity known as the synovial cavity. The synovial fluid contained in that cavity is the viscous liquid, and it is contained inside a synovial joint that actually functions as a lubricant. On the right, you can see the hip joint, which is a classical synovial joint. Now, within the synovial joint, there are articular cartilage. The ends of the opposing bones are actually covered by hyaline cartilage. Okay? And the cartilage helps to absorb compression. The joint cavity, which is also known as the synovial cavity, is unique to the synovial joints. The cavity is a potential space that holds a small amount of fluid, which in this case is the synovial fluid. Now, within the synovial joint, we have a space called the articular capsule. It is actually the joint cavity. The joint cavity is enclosed in a two-layered capsule, as can be seen in this picture. It has a fibrous capsule, which is a dense, irregular connective tissue, basically strengthens the joint, and it has a synovial membrane. So, there is this is the fibrous capsule and this is the synovial membrane. And the synovial membrane is made up of loose connective tissue. It lines the joint capsule and covers the internal joint surfaces, and it also functions to make the synovial fluid. The synovial fluid is a viscous fluid quite similar to the raw egg white. It contains glycoprotein molecules secreted by fibroblasts. The articular cartilage and the joints in general are nourished chiefly by the synovial membrane. Now, there are actually reinforcing ligaments to this joint capsule. So, the reinforcing ligaments often are thickened part of the fibrous capsule, which is indicated here. Sometimes these ligaments are extracapsular ligaments located outside the capsule. Sometimes there are intercapsular ligaments located inside the capsule. Now, the synovial joint is richly supplied with sensory nerves that can actually detect pain and can monitor how much the capsule is being stretched. The synovial joints have a rich blood supply. Most supply, the rich blood supply is mostly to the synovial membrane. Extensive capillary beds produce basis of synovial fluid, and branches of several major nerves and blood vessels. Examples of synovial joints are the shoulder joint, as you can see, with the joint capsule here between the glenoid and the humeral head. So, the synovial joint is formed due to articulation of glenoid and the femoral head. A lateral view of the glenoid is shown here. Other examples of synovial joints are the knee joint. Clearly, it is shown here formed between the distal part of the femur and proximal part of the tibia. The other example is a hip joint. So, a femoral head of the femoral head of the femur actually articulates with the acetabulum, which is the socket, and the acetabulum is a part of the pelvic bone, and herein there is a synovial cavity that forms the synovial joint. The temporomandibular joint is a special synovial joint. It is a hinge and a gliding joint and is one of the most constantly used joint in the human body. So, it forms, you can see in the picture, it is actually formed, the mandible articulates with the skull at the temporomandibular joint, which is a highly complex joint. It contains an articular disc as shown here in the picture in the inset, a purple disc. It can glide above the disc. It can behave like a hinge below the disc. So, the movements in the temporomandibular joint are depression, elevation, protraction and retraction. Now, let us compare the types of synovial joints with the mechanical joints. On the left, we have the skeleton and the joints within the skeletal system can be compared with planar joint, hinge joint, pivot joint, saddle joint, ball and socket joint, and condyloid or ellipsoid joint. So, examples of planar joint is shown in the finger joints. The pivot joint can be compared with the joint formed between radius and ulna in the elbow joint. Hinge joint, classically elbow is also a hinge joint, and the condyloid joint or the ellipsoid joint is formed at the fingers. Let us consider the planar joint. The planar joint is formed by bone surfaces which are slightly curved. In the planar joint, only side to side movements are allowed and the rotations are prevented by the ligaments. The examples of the planar joint are intercarpal to intertarsal joints in the hands and fingers, sternoclavicular joint in the shoulder, and vertebrocostal joints. Hinge joint is actually formed by convex surface of bone which fits in concave surface of the second bone. Okay? it actually behaves like a door hinge, which means that it allows rotation about one axis. Examples of the hinge joints are knee, elbow, ankle, and interphalangeal joints. The movements produced in these joints are essentially flexion, extension, and hyperextension. The pivot joint is formed when rounded surface of a bone articulates with the ring formed by the second bone and the ligament. The pivot joint actually offers monoaxial movement since it only allows rotation around the longitudinal axis. An example of a pivot joint is the proximal end of the radio-ulnar joint, as you can see here, and the movements that are offered by this joint is supination and pronation. The condyloid joint is formed when spherically shaped bone fits into a oval depression. It is biaxial in nature, the movements. So, flexion, extension, abduction, adduction are possible movements. Examples of these condyloid joints are wrists and metacarpophalangeal joints. The saddle joint is formed when one bone is saddle shaped. The other bone fits like a person riding on the saddle. It offers biaxial movement. Circumduction allows the tip of the thumb to travel in a circle, whereas opposition allows thumb to touch the finger of the tip of the other fingers. Examples of the saddle joint are trapezium of carpus and metacarpal of the thumb. Let us now come to ball and socket joint. Here a ball actually fits into a cup-like depression. So, the movements are multiaxial, flexion, extension, abduction, adduction, as well as rotation. Examples of the ball and socket joint are shoulder joint and the hip joint. Let us now summarize the factors that influence joint stability. The first and the foremost important factor is the shape of the articular surfaces. Shallow, poor fitting articular surfaces hinders stability, whereas well fitted articular surfaces, for example the hip joint, improve stability. The second is the role of the ligaments. The ligaments unite bones and prevent excessive and undesirable motion. The third important factor is the contribution of the tendons. The tendons are the most important stabilizing factor in a joint. Now, let us consider the movements of the synovial joints. The synovial joints offer a large range of movements, starting from flexion extension, horizontal flexion, horizontal extension, abduction, adduction, internal rotation and external rotation, as shown in the figures. There are special movements also of the hands and feet, like the palmar flexion and dorsal flexion of the hand and wrist, pronation and supination in case of elbow. There is also dorsiflexion and plantar flexion, which refers to flexion and extension of the foot at the ankle joint. Okay? And there is also eversion and inversion, which refers to movements that tilt the sole of the foot away, which refers to eversion, or towards inversion, towards the midline of the body. So, towards the midline of the body is called inversion, and away from the midline of the body is called eversion. Let us discuss about the joint disorders. Pain and restricted movement resulting in reduction in productivity and quality of life for people with damaged major joints like hip, knee, shoulder and elbow is quite prevalent in the modern society. Most of the patients who have these disorders can be classified as bone degenerative diseases like osteoarthritis and rheumatoid arthritis. The patients with osteoarthritis and rheumatoid arthritis form the majority of the disorder patients. Apart from that, fracture in bones can happen in 12%, about 12% of the population. Here we can see that intertrochanteric fracture in the femur is shown, as well as femoral neck fracture, which is a common problem or joint disorder in elderly patients. Apart from the arthritis and fracture, the other joint disorders are due to traumatic injuries. Now, in case of arthritis, you can see here an arthritic hip joint and arthritic knee joint. The cartilage covering, say, the femur bone is worn away, giving rise to a structure which is irregular and rough. Moreover, the joint space, the space between the acetabular cavity and the femoral head is actually decreased, and there is a potential chance of bone to bone contact giving rise to pain. In case of arthritic knee, here in the picture, that one condyle of the femur is seen to be almost fused with the tibia, and the space between the two bones is actually decreased as compared to the other part of the joint. In order to treat joint disorders, arthroscopy and arthroplasty may be undertaken. Now, what is arthroscopy? Arthroscopy or keyhole surgery is a minimally invasive surgical procedure that can be performed on a joint. Its main instrument is an arthroscope, through which the interior of the joint may be inspected or operated upon. In this procedure, an examination and sometimes treatment of the damage is performed using an arthroscope, endoscope or other instruments that are inserted into the joint through small incisions. Arthroscopy procedure can be seen here can be performed for reconstruction of torn anterior cruciate ligament as shown in this figure. The advantage over the traditional open surgery is that the joint does not have to be opened up fully. For a knee arthroscopy, only two small incisions are made, one for the arthroscope as can be seen here in the figure, and one for the surgical instruments to be used in the knee cavity. This reduces the recovery time and may increase the rate of success due to less trauma to the connective tissue. The surgical instruments are smaller than the traditional instruments, and the surgeons can view the joint area on a video monitor and can diagnose and repair torn tissues such as ligaments. On the other hand, the arthroplasty is a reconstructive surgical procedure of the joint using implants and prosthesis. I repeat, a reconstructive surgical procedure of the joint using implants and prosthesis. In this procedure, the joint is actually opened up and parts of the bone near to the joints are either resected or removed using surgical tools and standard surgical procedure. Thereafter, the implants are fixed within the resected bone structures to give rise to a newly constructed or newly reconstructed implanted joint. Arthroplasty can be of different types. Here in the slide, total hip arthroplasty and hip resurfacing arthroplasty has been presented. Apart from the total hip and the resurfacing procedure, there can be also hemiarthroplasty, which involves partial replacement of the joint. Now, in the hip resurfacing arthroplasty, the femoral head is resurfaced using a mushroom-shaped femoral component. The acetabular component in both the total hip and the resurfacing procedure is essentially a surface replacement, although the design of the acetabular component can actually vary from one case to the other. The lecture is prepared based on the following references, and thank you for listening.